Welcome to What to Expect at Your Child's Dental Cleaning. A child in the dental world is considered a child until age 14. This video is intended to show an overview on what is really happening during a kid's dental appointment. First, we'll call the patient back, we'll check with the parent or guardian and ask if there's any changes in the patient's health history and or if there are any dental concerns. Once the child is seated, we ask how school is or how their summer is going. We try to make them feel comfortable and talk about something new and exciting that may be going on in their life. Then we will check and see if the patient requires any x-rays today. If the patient does require x-rays, we start by placing a lead shield with a thoracic collar on them. I personally like to try and make x-rays fun, and I like to joke with kids that I'm taking photos of their teeth with the oldest, funniest looking camera ever. That's my go-to joke, and it usually works. We use a small sensor for kids, as you could see the difference between the big size 2 adult sensor and the small size 1 child sensor. It's much, much smaller and more comfortably fitting for a small mouth. Generally, the first time we take checkup x-rays, bite wing x-rays, is around age 5 or when the first adult molars erupt. My awesome model patient in this video, Ella, is 11 years old, and today she is due for bite wing x-rays. Bite wing x-rays are indicated routinely once a year, but each patient has a different x-ray frequency and is evaluated based on an individual basis, and each case and Carrie's risk situation is different. Again, here I am trying to make jokes and distract against any discomfort that may be happening, because I know they have small little mouths and it's hard to bite down even if you're an adult. Comedy is my go-to in every situation. I try to make it fun. I like everyone to have fun, and I like everyone to smile, because that's what your teeth are all about, smiling. So next, we lean the patient back in our roller coaster chair and we count the teeth and mark which teeth are existing on the chart. Like I said, Ella here is 11 years old and she is in the heart of the mixed dentition stage. Lots of adult teeth, lots of baby teeth, and lots of missing teeth. Another question I like to ask kids is if they have noticed any current wiggly teeth. It's always fun to hear their stories about how they've lost teeth and how they get prizes at school for losing teeth. It's funny, all the stories they have. So now, to count the teeth, we use a mirror and an instrument called an explorer, aka the tooth counter. And once everything is in the chart, we start cleaning the teeth. But we have to make sure everything is marked existing or missing in the chart so we know, what kind of teeth we're working with. There's a lot of baby teeth, there's a lot of adult teeth, there's a lot of missing teeth at this stage in life. Next, now each office may be different. I know some prefer to polish first and then scale, but I personally usually scale first and then polish. Depending on the age and plaque and tartar buildup, we may scale with hand instruments, but if the child is very young, 3 or 4 years old, or no plaque is observed, sometimes I'll just use the explorer, aka the tooth counter, and sometimes this step is not required at all. So it's kind of case by case. But if we are scaling with hand instruments, generally we will use the mirror again, and we will occasionally wipe the plaque off the instrument onto a gauze pad. So we scale, and make the teeth super smooth, free of any plaque bugs. Oftentimes, the light is way too bright and gets in everyone's eyes. So if the office doesn't provide sunglasses, feel free to bring your own and wear them so you won't have to have the bright sunshine in your eyes. And now you have a nice, comfortable cleaning. You get to sit back and relax like you're at the dental spa. So after scaling all the surfaces of all the teeth, may I note how nice these camera shots are, right? Ooh, so time for Mr. Thirsty. Sorry, I was distracted by, look at how good these shots are. Okay, time for Mr. Thirsty, our suction. He drinks up all the water we use to rinse off the plaque bugs. So Mr. Thirsty's oftentimes a hit, sometimes a little loud and scary, but we try to make him fun because he's thirsty and he's funny. So watch him here drinking away the water. Oh. This one's really cool because you can actually, it's kind of clear, so you can see the water suctioning through Mr. Thirsty. Sometimes you can't really see what's going on, but here you can see it. Now we're just gonna show us kind of finishing up. We did all the front teeth, the anteriors. Now we're gonna scale all the back teeth, the posteriors. And after everything is scaled and rinsed and clean, we will polish. Here I'm asking Ella which flavor of polish she would like. Currently our choices are cotton candy or blue raspberry or mint, and she chose blue raspberry. You can see the fabulous blue raspberry here. We're using a Profi Angle, aka Mr. Superhero toothbrush. He spins and cleans your teeth like a superhero would. He dips into the blue raspberry and then he superhero-ly cleans your teeth. How many words can we use? Adjective, adverb. Superhero, superhero, superhero. Look at that blue. Sometimes I like to joke that they're Smurf teeth. Did you just kiss a Smurf? But I don't know, I'm always trying to make jokes. Sometimes they're funny, sometimes they're not. Mr. Thirsty's drinking up the blue now. He wanted a taste of the blue. And that's just how it goes. We're rinsing, and then we're polishing, and then we're rinsing, and then we're polishing. And we just keep repeating that until all of the teeth are clean, polished. And then at the end, we do a really great rinse everything away, and then we floss. After we floss, I use the air, which is the same water instrument, but it's the other little button. We like to blow the air on the teeth, and that confirms that we didn't miss any spots. So there's no plaque bugs hanging out when you blow the air on the teeth. It dries the tooth so you can clearly see if there's any residual plaque left over. It's kind of like our double check, and then if there is anything, we'll go back and remove it. We'll do an oral cancer screening. We check the sides of the tongue, we check the roof of the mouth, the back of the mouth, all around the mouth, make sure everything looks healthy. And then we might go over some oral hygiene instructions at home care while we're waiting for the dentist to come in and do the exam. We also try to go over all the stuff we're giving you in your goodie bag so you know how to use it when you're at home. Then once the dentist comes in, the dentist will also say hi, chat a little, see how they're doing, same thing, same greeting that the hygienist just did. And then the dentist will specifically check for any cavities and if there's anything concerning in the mouth. For super young kids, the real little ones, it's easy to just say the dentist is going to recount your teeth and make sure that we counted right, things like that. So we try to make it super fun. We want to be fun. So then after the dentist does the exam, we will do the fluoride. There are 2 types of fluoride in most offices. You can usually pick, or maybe they only have one or the other, or maybe they recommend one over the other. Right here, you see us demonstrating a fluoride foam treatment. The foam fluoride is placed in these trays, which is placed in the mouth and usually takes between 1 and 4 minutes. After it is removed, you have to wait 30 minutes to eat or drink anything. The good thing is that your teeth will still feel super smooth. Here we are demonstrating fluoride varnish treatment. I usually recommend this one because it has a little more fluoride concentration in it and the benefits may last a little longer. Plus there is no gagging to worry about because we are just painting the teeth, super simple, and you don't have to deal with that large foam piece in your mouth. The other good thing about varnish is that you can eat and drink right away. We just ask you do not eat anything sticky for 6 hours. The one thing about this one that people sometimes don't love is that the teeth feel sticky for a little bit, but I personally think it is worth it. A little more fluoride, a lot more cavity protection benefits. Again, for the little kids, I explain it as the vitamins for your teeth. So now we're done. You did it. You have beautiful, clean teeth, and it's time to walk you to the treasure chest, prize box, and get yourself a nice little toy because you did great, and we can't wait to see you again in 6 months. Thank you all for watching. Please like and subscribe if this video helped you. Share, share, share. And I hope to see you all again next week. Peace, love, and teeth.